Hi, I'm Rebecca of Craft Massage Therapy. I'm a certified lymphedema therapist, a massage therapist licensed by the state of New York, an oncology massage specialist, and an oncology massage educator. Thank you for joining me when we're going to talk a little bit today about diaphragmatic breathing, sometimes talked about as belly breathing or yogic breathing. But we use this here with our clients so much. It's a tool that all the practitioners tend to teach their clients because it is so useful in day-to-day life. And there are a lot of benefits that we could talk about, but we're going to talk about some of the top benefits. And we'll talk a little bit about where the diaphragm is in the body and what it does when it's working. And then in the next video, which you'll find in our playlist, is a practice of how to do that fundamental diaphragmatic breathing. So thanks for joining me. So one of the biggest benefits of diaphragmatic breathing is it's very calming, quite relaxing, and a lot of people will say it's very grounding for them, which is really important. Here at Bodycraft, we tend to work with oncology patients. So whether you're receiving cancer care, you've just had your diagnosis, you're halfway through chemo or radiation, or you are decades out of treatment, we're working with people across the entire continuum of oncology care. So really helpful for that population. We also work with lymphedema patients and people who are at risk for developing lymphedema, chronic pain patients, and pre and post-surgical patients. Now, we also do work with some people who have no significant medical history, which is always a fun fresh of air for us. But for anyone, pretty much anyone who has lungs, this is going to be helpful. Generally, again, quite calming. So anyone who's coming from perhaps a little medical anxiety background, diaphragmatic breathing can be used leading up to any of those doctor's appointments or any upcoming scans to help just calm your nervous system down while you're thinking about or preparing for those appointments. I personally tend to use diaphragmatic breathing when I'm in an MRI, which thankfully I don't have to have frequently, but when I am there, I do tend to get a little stressed. I find this brings me into a more positive relationship with my body, a more grounded place while I'm in the MRI machine. So that's one application. And also, if you're going to an event that's not medically related, that's causing a little bit of stress and anxiety, you can use this to help ground you as you're getting ready for the event, as you're walking into the event, right? So use it as you need to for that grounding and calming relaxation approach. And the reason for that is because it is addressing the parasympathetic nervous system. So we've all heard about the sympathetic or fight and flight response of the nervous system. That's to get you quickly out of danger. The counterpart to that is the parasympathetic or rest and digest nervous system. So we want to support rest and digest parasympathetic tone. And diaphragmatic breathing is a really great way to do that by de-escalating sympathetic response and upregulating parasympathetic response, right? It's also helpful, diaphragmatic breathing is also very helpful in pain reduction. So it might not take a level 8 out of 10 pain and bring it down to a level 2, but if you start with 8 out of 10 and we can bring it down to a 6, that is significant. So any of our chronic pain patients, any of our post-op patients will tell you, yes, this is really helpful for just bringing it down a few notches. It can help change the relationship you have with the pain that you're experiencing and help you resource yourself a little more effectively and advocate for yourself with a little clearer thought process. So again, really quite helpful. Another reason that we teach diaphragmatic breathing, and this is very near and dear to my heart as a lymphedema practitioner, as somebody who has lymphedema themselves, is it supports lymphatic system function, which is wonderful. So part of the reason for that being is it helps move fluid through the deepest lymphatic vessel, the thoracic duct, which comes up the back of the abdominal wall, comes up through an opening in the diaphragm before the lymphatic system comes to meet the venous angle right before the heart. So if you can work on your diaphragmatic breathing and support your lymphatic system, that is phenomenal for anyone, regardless of whether or not they have lymphedema or lymphedema risk, or they're newly post-operative and they're dealing with some swelling and pain. But again, really helpful for anyone who's had trauma to their lymphatic system, whether that's from like a bike accident or they fell and, got themselves a little jammed up on the street, or they've had lymph node dissection, lymph node biopsy. So great for lymphatic support. It can also help with some GI issues like acid reflux, some abdominal pain, constipation, bloating, and distension, depending on the cause of these GI issues. Part of it is it just can help with that intra-abdominal pressure, get some gases moving through and out your body. It can also help with that peristaltic action to get the feces moving out too. So in that sense, it can help with constipation and just general discomfort because of those conditions. So really helpful for that. So again, going back to the first point, which was very calming, very grounding, it can help us psycho-emotionally, especially with anxiety. So if you're experiencing some heightened anxiety, while it won't necessarily stop a rising panic attack and squash it completely, it will help with some mild anxiety, maybe even moderate anxiety, by helping, again, upregulate that parasympathetic tone. Now, if you are someone who has been working to bring down anxiety levels, and you kind of know the precursors for yourself, oh, this is starting to happen. It tends to happen when I'm leading up to a panic attack or when my anxiety is ramping up, then you can go ahead and take a couple of minutes to work on some diaphragmatic breathing, bring your nervous system down to a more grounded place, support that parasympathetic tone again, to hopefully keep the anxiety levels from blossoming up into something more significant. Again, it might not stop a panic attack, but it can help you resource yourself more effectively while you're noticing the trajectory increasing. Okay, so those are just a couple of reasons. It is not an exhaustive list. Just those starting four is just the tip of the iceberg. Now, what and where is the diaphragm? So the diaphragm is the muscle of respiration. I love to think of it of the way the classic anatomists talked about it, of the muscle of inspiration. So we're bringing in fresh and new with that inspiration, and we're letting go of the old. So fresh, new air into our lungs, and then really making sure we clear out and get all that used air out of our lungs. Where is it in the body? It separates the rib cage from the abdomen. So if you find your rib line here, you can trace all the way around to the back. The diaphragm attaches along that rib line, right? So those are the attachment points, and try not to poke yourself too much, especially if you have long nails. But it might be tender in some people who tend to breathe up high and forward and their ribs are flared out, or rib flare from something like tissue expanders or radiation therapy, right? So that can get a little uncomfortable. So they're two domes of this nice, beautiful muscle, and it comes down and attaches around the back of the abdomen and inserts along a central tendon to the lower back, to that lumbar spine. And it's also where the hip flexors, the psoas, come up and they interdigitate. So if your diaphragm is not moving very well, it might inform how the hip flexors are moving and vice versa. So that's a fun thing to start to explore, especially through movement and breath work. Now, how does it function? When you inhale, if here are my two diaphragm domes, as I inhale, the diaphragm is going to pull down by that central tendon towards the pelvic floor, helps suctioning air in. And as you exhale, it pushes up towards the crown of your head and helps expel that air out. So it's really one of these beautiful functional things that you're built with. It's really quite astonishing in how well it can work. In the next video, as I said, we're going to go over kind of breathing 101, the basics of diaphragmatic breathing. So I hope you'll tune in for that, find it on our playlist. If you have questions for us, please reach out to us at bodycraftmassage.info. Again, our website is bodycraftmassage.info. You can always email us at contact@bodycraftmassage.info. contact@bodycraftmassage.info. Thanks so much and hope you have a great day.